Yes, other prescription medications. Other prescription medications. What are other prescription medications? Let's see. Which are other types of prescription medication? Yes, everyone. We have talked about analgesics, we have talked about antibiotics. We want to talk about other prescription medication. And I'll go through because we'll do them. We will do them when time comes, So if you are coming into the channel right now, the person you are seeing is Dr. Benjamin the Wise Guy. Is the channel. Wherever you are staying, wherever you are chilling from, welcome, much welcome to this channel. Here sometimes we laugh, sometimes we make fun, sometimes we discuss medical things, sometimes we deviate a bit. So welcome, my friends who is watching. If you are a new guy to the channel, hit the like button and don't fail to subscribe to this channel. A lot of nice people, a lot of a lot of people here watching. So you are one of them and you have not subscribed to my channel, man. What are you waiting for? Please hit the like button and subscribe to my channel. So today I want to go through some other types of prescription medicine. We did just analgesics, which are painkillers, and we also did antibiotics. But there are so many types of prescription medicine out here. Let me name them. If you are here and you are watching me from, tell us where you are watching from. If you are watching from Africa, any country in Africa, please hit the like button and tell me you are watching from Africa. If you are watching from the US, any country in the US, tell us which country you are watching from in the US. We interact, we socialize, and we make it have fun. So welcome, my people, welcome, my friends. And any question is welcomed. Any question is welcomed. Any question is welcome. So my friends who are here, it's your first time, we are discussing about prescription medications that you cannot just go over the counter and tell the pharmacist, I need this certain drug. I need this drug because I saw it helped my friend so much. These are medications that you need to have a doctor's diagnosis or be regulated by a doctor so that you can have them. So anyone who is here, who is watching, Dr. Ben is here. Ask Dr. Ben some questions. Ask Dr. Ben some questions. Big up everyone who is in the chat. Big up everyone who is in the chat. And what are the types of what are some types of prescription medication? Strong analgesics, strong painkillers used to moderate severe pain. Those ones are regulated drugs. They are prescribed like morphine. We talked about them. The strong analgesic, ketamine. Those are oxycodone. You remember we talked about oxycodone. You cannot just walk in pharmacy and tell the pharmacist, man, there was a time I used oxycodone and it worked miracles. Please sell for me oxycodone. Man, the pharmacist will tell you, please go and find a doctor. Get a prescription and I'll happily sell it for you. So guys, why are you watching and you aren't liking? Hit the like button. My friends. Hit the like button. And if you have not subscribed, subscribe. So strong analgesic like morphine, oxycodone, fentanyl. By the way, fentanyl, if you've seen several documentaries in Southern America, most of the people are addicted to fentanyl. And it's not good. Fentanyl is killing youths here in the world. And you who is selling fentanyl and oxycodone, there is an opioid like benzoxine to make people feel good on a short time. Man, even if you will not be arrested, think twice. Stop making people ruin their lives. So other types of prescription medicine are like anti-diabetic medicines, control blood sugars. And something like empagliflozin, people use it in the injection. People use it to reduce weight. I don't want to name that thing that people are selling. And it's bad. You are using the adverse effect to reduce weight. One day you will reduce weight and it will be bad to you. You will feel bad. So don't use drugs that are not supposed to use for the wrong cause. You are using a drug because of the adverse effect. You are using a drug because of adverse effect. Like I usually like saying something like those people that they say, there was a time I was this C4 tablet. Ladies were saying, if you want to gain weight and get good gluteus, if you want to gain weight and get good gluteus, use the C4 tablet. My friend, C4 tablet is called cyproheptadine, and cyproheptadine is an antihistamine. If you have hives, you have allergic reaction, you use it. And you are using it because when you take it, you sleep a lot and you get appetite, you eat and then you become big and you think it is working on your no, don't go that way. Get a doctor, let a doctor advise you the right way. You see that? Like Dr. Ben is helping you to understand these things. You check it out. So anyone who is coming here right now, thanks for those that are hitting the like button. But please tell me where you're watching from. It is 10:30 p.m. here, 10:33 p.m. So let's do some talk. Let's talk, my people. Let's talk, my friends. Let's get talking. You see? You don't use drugs because of their adverse effects. Some people use right drugs because of adverse effects. So the adverse effects is the right effects to them, but what they treat is not. Like a person who is using anti-diuretics to cut weight and is not diabetic. That day you'll find yourself in a coma because you are using the right tablet for the wrong tablet for the right cause. For personally yourself the right cause. And you see, it's not good. When you find yourself in a coma, you start blaming people that you did not come visit me in the hospital, or you did not even fundraise for me. No. Get doctor's prescription. Let a doctor advise you on how to use. If you want to get good gluteus, don't use C4 tablet. Go to a doctor, let a doctor advise you. Antipsychotic, treat conditions involving psychosis and certain other psychiatric effects. So antipsychotics are drugs that work on brain when you are psych. You see my guys, and you are using it because you want to be totally high. I want to go to the party and tell people, hey, I used olanzapine, man. I slept out. I took beer and took that one tablet, man. It is antipsychotic. And when you're taking antipsychotic and you are not a psychotic person, you know the effect. You know the effect, my friend. The effect is a boom. You will start being psychotic, or you'll start having depressant effects. You'll start having issues that are not good for yourself. So let's talk about something that is important. Siavash. Hi bro, Siavash. Hey, your name, my friend. Siavash. How are you? I'm fine. I'm talking about medicine, other medicines for prescription. Siavash Sabzevari. Siavas Sabzevari, I'm good. Hit the like button, Siavas, and subscribe to the channel as we talk. Have you ever gone to a pharmacy? I don't know. Siavash, which country are you from? Which country are you from? So that I can ask you that question. Which country are you from? Some people use antidepressant because you want to sleep. It's my name, and Sabzevari is my last name. Oh, okay. So you have conjoined Siavash and Siavzaveri. Siavash and Siavzaveri. Ah, nice one. Are you from South Africa or Southern African countries? Or which country are you in? Welcome. Let's continue. Antidepressants. Talk about depression. And you want to take antidepressants because Iran, bro. Oh, Iran. Okay. Iran. Wow. Nice one. Now, in Iran, do you just go to a pharmacy and you tell them, I want antidepressant? I think I'm stressed a lot. Siavash, tell me, do you just go to a pharmacy and then you tell them, I feel I'm depressed, man. Give me a amitriptyline. Good year, Gypsy Corner, like that. Good year. Remind me, which country are you from? We are talking about prescription medication. I really depends with countries, because one person from Uganda told us, Uganda, you just walk in a drugstore and you tell them, I need a drug, I need this drug, and they will sell you happily. Hi, Benjamin. Hi, good year. And they will sell you happily. So, you guys, as you're watching, please tell me which place you are watching from. Tell me which corner you are watching from. Jamaican uncle, blessings to you, Benjamin, and everyone in the platform. Jamaican uncle is here. I know Jamaican uncle in the US, you cannot just walk in a market, in a hypermarket, on a drugstore, and then you buy drugs. You cannot. That one is a no. But there are some countries they do. So we are going through other types of antidepressants. Strong analgesics used for moderate pain. I come from the country of medication. Which country is that of medication? Which country is that? A country of medications. Which one is that? Please, people, let me understand which country is this. A country of medication. I can see good year is a house. Jamaican uncle with another gadget there that we are not used to. Siavash from Iran. Yes, let's continue. My friend. As you come, hit the like button and tell me, hey, doc, I come from Zambia. Hey, doc, I come from Southern American country. And this is how we do things. I've seen, there was a time I see someone taking anticonvulsants drug, anticonvulsants medication, anticonvulsion. that control seizures. When people are having epileptic moods, multitasking right now, but I'm giving my real support. Big up Jamaican uncle. Uncle, just see what time I'm coming live today. It is 10:39 here. Man, the day has been a day of ups and downs. A day that I cannot even comprehend. I've been so busy, but I said no, I have to come. I think I did a video while I was in an integrated molecular unit somewhere in a hospital. I was up and down working on some patients, and at least I worked on them well. They are good. So whoever is coming, big up yourself. Thank you for tuning in my channel. Thank you for blessing it up. Thank you for making it happen. You are blessed. Benjamin, where do you come from? I come from Kenya. I'm a Kenyan. I live in Nairobi. I'm a Kenyan. I live in Nairobi. Karibu Nairobi. Nairobi, the doctor who loves singing. A doctor who comes online and loves singing and feeling good. Yes? Corticosteroids. Corticosteroids. Today I'm talking about prescriptions that you should take with a prescription. Corticosteroids that reduce inflammation like prednisolone and dexamethasone. Because when you take the prednisolone with a little cough, you stop faster. You want to go every time to buy prednisone. My friend, hey, if you are a man, prednisolone is a steroid and it makes the glands be fat faster. Let me use that name. You know, glands like the prostate gland, and you are hey. Stop using corticosteroid. There is another one that people like a lot, the pink tablet. Who knows the pink tablet? Guys, when you are coming in, don't forget to hit the like button, man. And if you are a new person, ask us, come to the chat and tell us where you're coming from, which country you reside. You know, let's get interactive. Don't just watch the doctor while the doctor is talking. Help the doctor to interact and have the session lively, you see. So there is that tablet with the pink one. I'll tell you one day. It contains 2 steroids. So when people are so it was allergic to something like hay fever, dust, or it is so cold and someone is having a flu, is coughing, this is the main thing that the people are going for. They were going for this tablet. If you know it, tell me, the pink tablet. I'm not talking about loratadine, no. And after 3 years, what happened? Many men, 50 Cent said, many men started having what? Started having balls, you know, prostate, balls, no, some things I cannot name them. So, hormonal medicine like levothyroxine, people that have thyroxine problems, and insulin, and male factor. Male factor, male factor. Okay, male factor. That is good here. Or I'm using a translator. Good here. What about the male factor? Timestamp, moderation, community reactions, timestamp. Wait. Yes. Let me check that one. Yes. Okay. Yes. So you, because your mom had some effects on sweating, tremors, and they went and did some tests, and they found that it is the thyroid which has hypothyroidism. Maybe your mom has low T3 levels, and when she started using levothyroxine, it became better. You with the same symptoms, you want to use the same medication. Please never. You know, when you are using, let me tell you about hormonal medicines. Hormonal medicines are very funny. When you are using them and your body have the same hormones that is producing, the body stops to produce the hormone that is supposed to be producing. So it starts to do what? to depend on what you are giving it instead of it balancing itself. You see, so these hormonal medicines, sometimes they work in a mode that is called negative mode, not negative mode, negative feedback. Yes, negative feedback. You give it, it stops producing what it should be producing. So you feel that it is working, but you are doing the wrong. Doing the wrong thing means you are giving it artificial medicine and it is producing natural medicine. You see that? My good people. You see how I'm educating someone. So don't use it if it is not prescribed. You see, you start having women, you start having irregular menses. You start having irregular menses, and what you can do is to go to a pharmacy and you start taking, because your friend was advised to do what? To take those drugs. Which drugs are those? Family planning pills. My friend, family planning pills are different, totally different. They contain different components, and the doctor chooses the right component according to your problem. You see that? And that's why women that are breastfeeding are given a different pill from those that are not breastfeeding. And you, because you are having irregular menses, FRC, how are you doing, my sweet, lovely sister? Hey. So you are a mother or not a mother, you decide that this thing, I was advised by my friend that if you have irregular menses, you take this. Man, you are slowing slowing estrogen and progesterone, and problems will link up. So hormonal medicines, guys, let's not use them for the wrong cause. You see, let's not use them. We have said levothyroxine. The other one we have said, if you are watching me, please tell me which country you are watching me from, because I want to pile up some statistics on these drugs. So tell me which country you are coming from. There is something I will be asking you, if it is okay with you. So hormonal medicines like insulin, man, one day if you feel that at your symptoms, I'm feeling like my sugar levels are high, and then you have a hard headache, painful headache, and you go for your uncle's insulin, man, you can go zero. Sugars will go zero and you'll have a rough time. You see, cholesterol lowering medicine reduce blood cholesterol and cardiovascular risk. They reduce blood cholesterol and cardiovascular risk, like atorvastatin, rovastatin. Your body has several types of cholesterol. One type of cholesterol is called low density lipoprotein. The other type of cholesterol is called high density lipoprotein. You have something that is called triglyceride, and you have something that is called total cholesterol. How many are those? So when you want to take these drugs, a doctor looks at the levels and the ranges of this cholesterol before you get them. Just imagine if you take atorvastatin and then you clear all the good cholesterol, which is supposed to clear the low density lipoprotein for you to be okay. Your veins will clog and arteries will clog with cholesterol, and then you'll start having problems. So you see how we are talking, my friends. We are talking and we are relating. Diuretics. Diuretics are those drugs, when you take them, you go to the loo so much. You go to urinate so much. Increase urine production and helps manage fluid overload for some types of hypertension. Fluid overload. And you, because someone was having a headache because of fluid overload and you used that drug and failed. You know, there are some people when they travel, their feet swell. You drive for long distance, their feet swell. So when you get home, you relax, it gets better. So you, because your mother, your sister used it, and it's on furosemide or spironolactone, which is a diuretic, you decide to take one, hey, you will pass out. Let the doctor advise you on these things. These are very important things. Yes. There is something like anti-ulcer acidic suppressant medicine. Reduce stomach acid and treat some ulcers and reflux. These are drugs that are really abused, and they are sold over the counter. You go over the counter, you see my stomach is bloated and I'm feeling like I'm having acidity. Please help me with. Hey, you know what will happen? Do you know something called antacid there too? Most antacids, they reduce bone density. Proton pump, they're called proton pump inhibitors. So you are inhibiting some factors for your bones to be tough. And then because your child always have acidity, you decide to take antacid. Every time you feel your stomach is bloated, you faster to the pharmacy, you take antacid. You know the antacids that you usually love, you know them. Those antacids, when you are using them, especially in children that are not of age, you are destroying their bones. Listen to me carefully now. If you are a new person, hit the like button and say, yes, doc, yes, Mr. Doctor, give us the advice. Yes, I'm advising you on prescription medication. I can see some people are coming in. If you're coming in, subscribe to the channel, and you'll get notifications. And tell me where you are watching from. If you are watching from Africa, if you are watching from the US, if you are watching from everywhere in the continent, please tell me where you are watching from. I can see Efasili Penga in the house. I can see Jamaican uncle and some new friends. But if you are here, Tim and Shona, hi Benjamin the champion. Tim and Shona, today you're here. Nice one, Tim and Shona. Big up yourself with some flowers for Benjamin. I'm educating people on prescription medication, Tim and Shona. Tim and Shona are YouTubers, right? If I know, yeah, it should be. So if you are watching here, get on and interact and give subscriptions to everyone that you have not given. Yes. Nice. So as I'm talking, I'm advising. As I'm advising, even you can advise me. These medical issues are just in vice versa. You tell me how you do things, I tell you this is wrong or this is right. Met you on Barry walking exercise. Nice one. Barry, my good friend. Okay, nice. Tim and Shona, welcome to the chat. Let's interact. Let's get going, my friends. Big up yourself. Now, there is something that is called sedative and certain sleeping pills. You don't have sleep because you are stressed up. What should you do? Find a solution to the stress you have. You don't have sleep because there is a problem medically that you are facing. Let the doctor take care of that thing. Then you get sleep. If your pressures are high, let the doctor handle the pressures. Don't go for sedatives. May be prescribed for specific conditions and require careful monitoring. You know, a drug called promethazine. Please, if you have not liked and you're watching, please hit the like button and subscribe button. Hey, subscribe to the channel, man. If you haven't. There is a drug that is called promethazine. This promethazine is anti-nausea. Promethazine is called anti-nausea. And anti-nausea are those drugs that when you feel nauseated, yes, when you feel that you cannot vomit and you can vomit and the vomits are not coming out, you take it. It enables you to have the gut to pass food faster. There is another one that is called metoclopramide. So you take this medication because of that cause. But you know what we do at times? When you take promethazine, it kind of like sedates you. You feel like sleeping. Man, if I inject you with promethazine 25 milligrams and you have not been sleeping, you will sleep. So when you feel that you want to sleep, tomorrow is not work, you want to wake up tomorrow and at 5, take promethazine 50 milligrams. Now, the day that you will need this promethazine for real, the day that you will need this promethazine for the right cause, not the wrong cause, it will not work. Unfortunately, it won't work. You see? So let's not just use medications because medications are there, we should use them. Anti-asthma control medicines are for prescription. Help prevent asthma. Inhale corticosteroids such as budesonide and steroids, and should not be just be given anyhow. You just don't give budesonide with anyhow. You see, you don't just give budesonide anyhow. So those are the there is trouble. Trouble is asking. Let me check this out. Trouble, how is the going? Which country are you? Trouble Heart. Which country are you coming from? Trouble Heart. Trouble Heart is asking if it is a H2 antagonist. No, it's not. Promethazine, first generation antihistamine, and that's why when you take it, you sleep. It is main H1 receptor antagonist, not H2. You see, I am Rutos domain. I'm in Rutos domain. Okay, you stay there, man. It's good. Everyone should have. Let me not go there. We are told in YouTube we don't involve politics. Yes, let me stay right. It is H1, and it is a first generation antihistamine, and most H1 antagonist, receptor antagonist, they give sleep, and that's why when you take it, you sleep. H2 receptors are like ranitidine, formitidine, and then we have nizatidine and cimetidine. You see, ranitidine nowadays it's not used a lot, but it helps sometimes when it comes to acidity issues. Ranitidine. So let's get going. Thanks for that question. It's a good question. So there are several drugs that I've named, my people. Several drugs, and trouble Sihat. Welcome to. If you have not subscribed, subscribe to the channel, and you can learn more about some medical and medicine in this channel. I said we did antibiotics, strong analgesics, antihypertensives, anti-diabetic medications, anticoagulants, antidepressants, antipsychotics, anticonvulsants, corticosteroids, bronchodilators, anti-asthmatic drugs, cholesterol, diuretics, anti-ulcers, immunosuppressants, chemotherapy issue, and sedatives. All those men are not over the counter. So prescription only anti-inflammatory medicine are there. You see, NSAIDs are there. So I have 2 minutes to go. Okay, I have 2 minutes to go. So anyone with any question before I leave the chat? Anyone with any question before I leave the chat? You know, questions are good. And today I've had a very short session because if you look at the other video, I was somewhere else. So anyone with any question, I can see I have 2 minutes to go. 2 minutes to go. Yes. Oh, second gen H1. First generation H1, not second gen. So that's it, my people. Anyone with any question? I have 1 minute to go, my friend. 1 minute to go. Today I'm having very short sessions. Inanomani malongi matate ati mame kono motu ame. Any question? My 1 minute is about to drop down. My 1 minute is about to drop down. Jamaican uncle says, love, love, love. So guys, bye bye. See you tomorrow at 4:16:30 Kenyan time. Bye. I have to head.